Hi, good afternoon, and welcome to our second collaborative responses to COVID-19 webinar. We will be getting started in just a few minutes once folks have had a chance to join us. So thank you all for being here. If you do have any questions throughout the day or throughout the web conference, please feel free to type them into the questions box. We'll be doing our best to get to as many questions as possible, but anything that we don't get to, we will be passing along to our panelists or to our sponsoring organizations, and doing our best to get you answers to any of those things that you have. So yeah, and like I said, we'll be getting started in just a few minutes. All right, we're gonna go ahead and get started, and hopefully Senator Wiener will be joining us soon, but we'll let our other panelists introduce themselves first. Thank you all so much for joining. My name is Amanda McAllister-Woolner. It's she, her, hers pronouns. I am the director of the California LGBTQ Health and Human Services Network. We are an organization that's based in Sacramento, or a program of Health Access California, working to promote LGBTQ health equity policies and provide support to LGBTQ serving organizations throughout the state. And we're very happy to have some great co-sponsors of this webinar series. That today is the second webinar, and we'll look forward to continue to provide information, updates, and answer questions about how our communities are adapting to COVID-19. And the Epidemics Coalition has been with us since the beginning. I'm Courtney, or Craig, I don't know if one of you want to talk a little bit about ETE and introduce yourselves.
I'm on a conference call.
Hey, Courtney.
Oh, sorry.
That's okay.
Am I supposed to be introducing the Epidemics Coalition?
Yeah.
Oh, great. Okay. Hi, everyone. Sorry, I was getting my kids set up on a Zoom conference call. So my name is Courtney Mulhern Pearson. I'm the Vice President of Policy at the San Francisco AIDS Foundation, and also working on this and the Epidemics Coalition. We're a coalition of, I think, over 160 organizations and local health departments calling on the state to convene a plan, a strategic plan to end the HIV, HCV, and STD epidemics in California. So we're both calling for a strategic plan and would love more investment of resources and policy prioritization to make that a reality.
Great, thank you. And then our other co-sponsor today, Equality California.
Yes, hi, good to be with you all. My name is Tammy Martin, she, her pronouns. I'm the legislative manager for Equality California, which is the statewide LGBTQ advocacy organization here. We, as an organization, do a range of things. So I work on the state policy and legislative side, and I'm based in Sacramento. We also have a federal legislative director, which we decided to pursue after the last presidential election in order to better respond on a broader scale. We also have a Nevada state director recently and a whole program department that does community education and organizing to make sure that, you know, all of the policy that happens in Sacramento actually translates into action for the community, whether that's in the context of schools or immigration, our census work, health and HIV, mental health, etc. So looking forward to the conversation.
Great. Yeah, and then we're also co-sponsoring today is the California Legislative LGBTQ Caucus, and we're really happy to have a number of members with us today, including the chair and the vice chair, and former chair as well. On our call today. So I'm going to let them introduce themselves and hopefully we'll get the chair on soon to be able to connect. Just some minor technical difficulties. But let's go ahead and start with Commissioner Ricardo Lara. Do you want to, Commissioner Lara is a former California state senator. And has been a longtime advocate for LGBTQ health and wellness, as well as health for all Californians, regardless of immigration status. He's also done some great work in the Insurance Commissioner's office, responding to COVID-19, as well as sure that people living with HIV have access to healthcare, expanding access to PrEP, and also has led some efforts at the national level to loosen restrictions on blood donation by gay and bisexual men. We're very happy to have him with us today. Commissioner Arlada, do you want to take a couple?
I mean, you introduced me already, so it's fine. No, it's great. It's great to be on, and I hope everybody's, you know, feeling well and their families are safe as we try to navigate this new, you know, normal for us here. You know, obviously, as the highest-ranking openly gay, you know, constitutional officer in California, my heart and my passion is to make sure that we protect all our communities, especially looking through a special lens, our LGBTQ community, or people of color who are disproportionately being impacted by COVID-19 and, you know, not only the rates of infection, but how do we keep healthcare? How do we keep them insured? How do we keep them covered? And how do we lessen the burden on our working class families that now have lost their job, shut down their business, and are struggling to make ends meet, is what we're working on in the department. As you know, we are the largest consumer protection agency in the country. We are the largest insurance department in any other state. We have over 1,400 employees, which we all have transitioned to telework, because that was a major accomplishment for our staff. And we still keep, you know, the department open and running, especially now more than ever. Look, it hasn't been easy in this position. Going into it, being sworn in, we had fires, we had an earthquake, we had floods in Guerneville, and now we have a virus and a pandemic. So it has not been an easy sail for us as you know, for me as the insurance commissioner or the department, but very proud of the work that we're doing and look forward to having a fruitful discussion with you all.
Great, thank you so much for joining us today. We also have Assemblymember Todd Gloria with us. Assemblymember Gloria represents the beautiful city of San Diego, where I was born. And is a member of the Legislative LGBTQ Caucus and currently the vice chair. Assemblymember Gloria, do you want to take a few minutes to introduce yourself?
Sure, just very quickly, and you know how to get straight to my heart. Flattery will get you everywhere. Just say something nice about San Diego. I will be happy and smitten. Todd Gloria, he, him, and honored to be the vice chair of our California Legislative LGBTQ Caucus. Our chair, Senator Scott Wiener, I know will be joining us soon. Want to make ourselves available to share the best information we can. I recognize it's a scary time. While our community is not unfamiliar with dealing with health crises, this is something of a scale that's kind of hard to comprehend, and it impacts all of our lives in every aspect. So I think about many of the individuals on this call who, whether it's from a health perspective, from a nonprofit perspective, from a personal perspective, this is having impacts. The caucus is fully aware of that. In the last couple of weeks, our team members and staff have been retooling our caucus to try and be as responsive as possible. As our insurance commissioner, our trailblazer, our glass ceiling breaker, Ricardo Lara was saying, you know, there's just a lot that our community has gone through historically. We recognize the disparities and the intersectionality of who and what we are as a community can leave us particularly vulnerable to this situation relative to our lack of healthcare access, lack of generational wealth, list goes on and on. We're painfully aware of that, and we're doing our best to work on it. And it's part of why I wanted to participate in this conversation this afternoon, to make sure that we're hearing from every corner of California and doing the best that we can to be what we're supposed to do, which is to be advocates for our constituents and for our community. You know, many members of our community worked extremely hard to give the 7 of us who are legislators and our 1 constitutional officer a seat at the table. And we want to make sure that as we're spending tremendous sums of public money, that we're making sure that every community is being reached. I think as we see the numbers of infections in the African American community, we recognize that there can be significant disparities in how this pandemic may play out, and to the extent that it impacts our community directly or it impacts our allies. I recognize our progress as a community has not been solely through our efforts, and that many people have stood with us to help us achieve the progress that we've made. We now may need to stand with them, particularly if we find that they're deeply impacted. So as we look at this from a budgetary perspective, and I have to tell you that's pretty grim stuff for the state of California, and I recognize if it's grim for us, it has to be very grim for the nonprofits who are on this call, to a legislative perspective where we anticipate still passing some levels of legislation, probably not as much this year, but certainly some, to just general advocacy, being accessible and providing good information, which is what we're doing this afternoon. So thank you for this chance to join you all. Thank you for the work that you're doing in every corner of California, and let's have a great conversation, find ways that we can make sure that we're taking care of our people as much as possible.
All right, great, thank you. And I'm not sure if we have Senator Wiener on the phone. If not on video, Senator Wiener, are you there? Okay, maybe not. So work in progress, we'll get there. And we'll make sure that he has a chance to introduce himself when we are able to get him on the line. You know, just to kind of put this conversation in context and a little bit of background on why we are hosting this conversation and our previous web conference, and most likely some others. We know that that all of you throughout the state, our partners all over California, are you know, really having to adapt quickly, are worried about your community's health, are worried about how this virus is going to affect LGBTQ people living with HIV, hepatitis C, and other chronic conditions, and also how the economic impacts, how impacts on housing, and all of these various issues are going to impact our communities, especially and impact the organizations that are really the lifebloods of a lot of our local LGBTQ communities, the nonprofits, as Assemblymember Gloria said. So we are going to have a bit of an open conversation and some questions about some of the specific topics that we've heard from you over the last few weeks are really important to you. And then also, as I mentioned, if you have additional questions that you would like to direct toward any of the members on the line here, please, please do type those into the chat box or into the questions box and let us know. We will do our best to get you an answer to those questions. We won't be using the hand raise function during this call, so please type your questions into the chat if you have them, and we'll be keeping an eye on that. So first off, to get us started, Commissioner Latta, can you tell us a little bit about what actions the Department of Insurance has taken in response to COVID-19?
Yeah, thank you. I mean, as you can imagine, the latest numbers indicate that there's 3.5 million Americans who have lost their employer-paid healthcare, and that's disproportionately affecting a lot of the service industry where a lot of our young people are working, and so I guess there's been more than 1 million Californians who applied for unemployment insurance in the last month. So the loss of jobs and health insurance are going to hit our community specifically very hard, especially for those with fewer resources and less access to care. So we in the department, as you can imagine, trying to come up with some answers to the questions that we keep hearing from consumers, including businesses who are affected by the losses. We hear, what can I do if I can't pay my insurance premiums, for example? So, we've requested all insurance companies to provide policyholders with at least 60-day grace period to pay their premiums. And this is on all lines of insurance. So it's important that you contact your individual insurance carrier and ask them to give you that 60-day grace period. We hear, what if I don't have health insurance? If you've lost your employer paid health insurance or do not have insurance, obviously we've extended the deadline to pay for the ACA to June 30th with Covered California. And there's ways that we can get some subsidies for you that are available through Covered California that pay for almost all of your premium if you qualify for low or no cost coverage through Medi-Cal. And we also are using our Covered California as a shop and compare tool to see if you're eligible for any of this financial help. And what financial options are available to you now during this crisis. If you visit our COVID-19 at ca.gov, you could qualify for disability insurance, unemployment insurance, paid family leave, sick leave, workers' compensation, for example, if you have been infected or diagnosed at your work. And this also is something that's important for our undocumented community, who many of them are working in the fields, working construction still, who are in very high-skilled, manual labor. And if you are, contracted with COVID, you qualify for workers' compensation insurance, and that's critical for our undocumented community to know. And obviously, you've heard the relief on mortgages and banking fees and the statewide moratorium on evictions, with a lot of our own members leading the way, especially Senator Gloria and Senator Wiener. So we've also been asked about how does COVID-19 affect auto insurance rates, right? For example, folks can't drive because of the stay-at-home orders, and some insurance companies are proposing to give discounts on your premiums for your auto insurance coverage. We want more. We want to get a bigger chunk of that for our consumers, especially for folks who have lost their jobs, who can't afford to pay their rent or their mortgage. Let's give them more of a discount. So you'll be seeing us come up with some directive along the lines of this issue. And we also, if you have an expired driver's license, we don't want you coming into the DMV. So we've asked the insurance companies not to take away your good driving discount if you have one, not to raise your rates because you're driving with a suspended license, and to keep your rate intact that you have, because as we know, a suspended license can affect your premium depending on where you live and what companies you have. So we've kind of frozen all that, and we want people to feel that they're going to be taken care of just in case they get stopped by the cops and they have a suspended license. And make sure that doesn't affect your insurance premiums. And so we've done a whole host of things, and we keep looking at ways of how do we protect our small businesses who are forced to shut down and now need some sort of coverage to help fill the gap from now until we come to some sort of normalcy. And that affects our small business owners as well. We're talking to the industry now and seeing what we can do around this area. So we have had a whole host of different things. And all I would say, if you have any questions around any of your insurance products or your insurance needs, is to really call our 1-800 number, where we have live folks that are answering your calls, looking and walking with you through your policy and your individual insurance coverage, because we also know that coverage, and we sign these documents, and more often than not, we don't know what we're covered for. We don't know what our options are. And so we have staff on deck, fully staffed, fully capable to be able to answer your questions. And for many of your constituents as well, and the folks that you service, send them our way. We have staff willing and able Monday through Friday to walk them through these things. And that's the number's 1-800-927-4357, essentially 1-800-927-HELP. And we have live folks ready to answer a lot of these questions. And that goes for business owners, nonprofits, individual clients you serve, and of course your constituents.
Great, thank you. And I'm going to go ahead and type that number into the chat box too, so that folks can have that. So 1-800-HELP.
Yes, 1-800-927-4357. 1-800-927-4357.
Perfect. Great. Thank you so much. And that's really, really useful information. Assemblymember Gloria, do you want to share a little bit about what your office has been doing in response to COVID-19?
I don't think we have enough time.
Busy. Yeah.
It is the most surreal. I think this is probably true for everyone on this call. That's what you even call it. What do you call it? A webinar? Well, anyway, when you're working at home, but you've never worked harder. And that isn't to take away from our frontline healthcare staff in any way. I mean, they're the ones doing the real hard work. But when you're a place where you go to relax or whatever, and all you do is sit on things like this, and importantly, that's true for every member of my team. We shut down as a legislature in terms of adjourned. We went back to the districts. We're not in the Capitol, but every one of my staff members are still working. And I think it's really critical that we do. As I mentioned before, the budget's looking pretty grim. We got to figure that out. Our legislative packages are being trimmed down. We have to figure that out. But the most important thing, and I think many of the folks who are on this call probably know this, but some may not. And so it's important, like what the insurance commissioner was saying, is that we are a resource. And that's why we're probably busier than we ever have. My office has received a 10-fold increase in communication from constituents in terms of requests for assistance. The most obvious one is unemployment benefits. I think that many of you may have seen this statistic, but it bears repeating. In an average day in California prior to the pandemic, we would receive about 2,000 unemployment claims a day in the entire state. Now we're averaging over 155,000 a day. Over 2 million Californians have applied for unemployment benefits, and as a consequence, the agency that handles that, the Employment Development Department, is overwhelmed. And so many of you may have tried to call yourself. You hopefully applied online, which is the way we want people to apply. But maybe you have problems, maybe it didn't go correctly, or maybe you just have additional questions. And this has been complicated by the fact that the federal government approved the CARES Act, which is great, $2 trillion relief bill, but includes a number of modifications to the historic to the way that we've normally done unemployment, meaning to say there's an additional $600 benefit, and it actually expands the group of employees who are eligible for unemployment benefits. And so at a time when we're seeing more claims than ever, the program itself is changing. And as a consequence, we're having to reassign other state employees to work at the Employment Development Department. And a lot of that transition, a lot of that angst is appearing in my office, where constituents are calling, San Diegans are calling saying, I need help. And that's also true for anyone who has, a DMV driver's license it is expired, or tags are starting to become undue. List goes on and on. And so it has really been a tremendous amount of work that's going on. Every one of my staff members share with me that they're overwhelmed, and we're doing the best that we can. I think we're able to get some good work done, but I recognize there are a lot of people out there who's still waiting on hold at unemployment, who are trying to figure out small business relief packages. And so I guess just a top line, I want the folks who are participating today to just know that, please be patient, be persistent, and then where necessary, contact your state legislator if it's a state program or state agency you're dealing with. If it's a city program or a local program, call your county supervisor, your city council member, your mayor. And if it's a federal issue, reach out to your member of Congress, your U.S. senator. All of us are here working. We're all essential employees. Our offices are open and we're serving our constituents. And whether it's something relatively small and straightforward, like an individual unemployment claim, or simply trying to understand a big piece of legislation like the CARES Act, we're here to serve you.
Great, thank you. Thank you. And I think we have Senator Wiener on the line. Senator Wiener, are you there?
I've been here.
Okay, great, excellent. Senator Wiener is the senator from San Francisco, and also the chair of the California Legislative LGBTQ Caucus. Do you want to take a couple minutes to introduce yourself, and then also talk a little bit about what your office and yourself have been doing in response to COVID-19?
Sure, thanks for having me, and I apologize, I've actually been on for half an hour, so I didn't.
Oh no.
Just so people don't think I'm blowing this off, I guess there's something wrong with my link. Anyway, thank you for doing this. It's just such a hard time for our entire state and our world, and we know that the LGBT community is being impacted in disproportionate ways. Unfortunately, we don't have the data collection we need to really show that. It's great that data is coming out to show the disproportionate impacts, the horrible impacts on the African American community. That data is so important, and it shows that this pandemic is really harming particularly communities that are experiencing underlying health and economic inequities. And in the LGBT community, we also experience those health and economic inequities, and we know that our community is more likely to have some of the underlying health challenges that make COVID-19 worse, and other challenges as well. So we need to make sure that as both the federal government and the state move forward with supports for California, for the country, that the specific needs of our community are taken into account, and that our community serving organizations, nonprofits, are able to access resources both to survive and in order to serve members of our community. We're working to make sure that both small businesses and nonprofits don't get evicted during this pandemic. The last thing we need is to have a large number of community serving nonprofits in our community and elsewhere lose their space because they can't afford to pay rent. That would be so damaging in the long term. And so we need to really try to hit the pause button and maintain the status quo So we've introduced legislation, Senate Bill 939, to do that, and we're hoping that the governor will take that action. We also need to make sure that we're protecting our seniors who are at such significant risk. We see what's happening in nursing homes and just to our senior community in general. We know that LGBT seniors are more likely or less likely than other seniors to have adult children and may have lost a lot of their friend network during the worst of the HIV/AIDS pandemic in the 80s and 90s. And so a lot of LGBT seniors do not have the support that some other seniors may have. And that makes it all the more important for organizations like Open House and other organizations that work with LGBT seniors to be able to function, to check in, and to provide that support. We also, and I know this was touched on earlier, need to make sure that our renters, that we don't see mass evictions. We need a strong eviction moratorium, and then we need to make sure that renters are not expected to immediately pay multiple months of back rent once the emergency ends. We don't want people to be evicted now during this state of emergency, and we don't want people to be able to hang on to their housing during the state of emergency only to be evicted right after it ends because they don't have thousands and thousands of dollars to pay the back rent. And so we're working on that as well. So part of this is just basic stability of our community, and that applies to other communities as well. But we know that in the LGBT community, there's so much marginalization of so many people that we can easily fall through the cracks. And our job is to make sure that our community does not fall through the cracks.
Great. Thank you so much for saying that, and thank you for your advocacy and for the caucus's advocacy and recognition of how this will disproportionately impact LGBTQ communities, and for being that voice, at the table as these discussions are happening, making sure that our communities aren't left behind and that we do have the resources to address this. I think that's why we do have so many folks on the line today. Is because there is such interest in how we can respond. So we're going to get into a couple of topics that have come up, in questions and in conversations with LGBTQ orgs throughout the state, and that you all have some on the ground knowledge of. We know obviously that this is changing every day, sometimes multiple times a day. The governor's press conferences every day at 12, I think, have been incredibly helpful in making sure that the public has timely information. But we do know that this is a rapidly evolving situation, and so just we appreciate kind of like any insight that you have into our best understanding of some of these issues at this point in time, and where we are. The first question is for Commissioner Latta, and that is, for folks who maybe have lost insurance, their health insurance because they've lost a job, or who aren't sure how to access some of their health care. Do you have any additional insight into what protections the state has right now for folks, or what actions the state has taken to make sure that there isn't an interruption in health access?
Yeah, so what we've directed for those folks that have a health insurance product or policy that insurance companies provide a 60-day grace period. We're looking at, we extend that once the 60 days are met, where, as you said, we're living day by day. And so we're prepared to continue to make sure that folks are protected and keep their coverage for as much as possible. And you're seeing a lot of the health insurance carriers honor that. And so what we want is for people to call their individual healthcare insurance provider and figure out what the options are for themselves and their families. And if you have any questions or any complaints, to call us, and we can walk people through what to ask. We could get on the phone for you and your carrier to help walk you through the process. And so we want people to reach out to us if they have any questions or running into trouble with their healthcare insurance provider. Again, trying to offer as many resources as we can. And we're going to continue to monitor those companies that haven't offered the grace period to make sure that they're all participating in what our department are asking them. So again, and you'll see for the most part, people at the insurance company, the health insurance companies, are willing to do that because they don't want to drop you as a consumer or a client, but also understand what we're going through. So again, call us if you're running into any problems. We'll walk you through the process.
Great, thank you. The second question, Senator Wiener, it's good to see your face. Sorry about the technical difficulties earlier. Oh, I think you might be on.
You're on mute.
Oh no, now we can see you. But you can hear me, so I have all faith that you.
There we go.
Perfect. That's all right. We shall overcome. So you touched on this a little bit, and I think it would be, it's something that's come up a lot when we've been talking with folks, is the issue of housing. We know that LGBTQ folks are more likely to be housing insecure in the first place. And I know that this is an issue that you've done quite a bit. Can you talk a little bit about the protections for homeowners and anything that that folks should know about the mortgage exceptions that are available to homeowners who may be experiencing loss of income or any difficulty with being housed?
Yeah, well, I think what COVID-19 is doing in many ways, it is highlighting some of the major problems that we already had in California, and it's shining a big spotlight on them and making them worse. And we're seeing this with the lack of a real social safety net and how precarious it is for people who lose a job or don't have access to food anymore. I've been volunteering at the food bank, and the line, it's like the longest line for the food bank that I've ever seen in terms of lack of paid family leave, paid sick leave for workers. We're seeing it in just a number of ways, and housing is one of those ways where we have for many, many years, not just in California, but especially here, have really not done enough to make sure that everyone has access to affordable and accessible housing. And we don't build enough housing, we don't have enough protections for renters, and we don't invest enough in subsidized housing for people who are lower income. And so that's all just spilling out right now in a major way. And so many people who are renters are insecure, which is why I mentioned before we need a moratorium on evictions and a path out after the fact so people don't have a financial collapse when the emergency ends. And for homeowners as well, and especially, there are a lot of homeowners who are not wealthy, who are barely able to make their mortgage, and now they've just lost income. And so the governor was able to work out an agreement with the bulk of the major mortgage lenders, all of them except for Bank of America. And they will have a 60-day forbearance. They can contact their lender and ask to delay payments. And also that will mean that it won't be reported to the credit bureau, so you won't get a credit downgrade as a result, and you won't get any penalties. And so whether you're a renter or a homeowner, We just want to hit the pause button, let people be stable now, stable after the fact, and we do have a lot to work out. After this emergency ends, there's going to be sort of an economic reckoning in a lot of ways, but we at least want to have the space to be able to work through those issues.
Great, thank you. And we also know that there, are a lot of LGBTQ folks who were experiencing homelessness before this crisis started. We've seen that disparity in our communities for many years. And Assemblymember Gloria, I know San Diego's been taking some action to address that in the wake of this current crisis, and wonder if you want to talk a little bit about what some of those actions have looked like and maybe what the state may be doing at a broader level.
Yeah, thanks for knowing that. And, I'll just confess that historically I've been very frustrated by San Diego's leadership, or perhaps lack thereof, when it comes to the homelessness issue. But in the context of COVID-19, I think that in partnership with our local leaders and nonprofit leaders, we're doing a good job. Could always do better, but we're doing good. And in terms of the strategies that we're using, I mean, interestingly, it's some things that you would think would be that I would have said were unthinkable a month ago. It's probably most evident in the fact that we've taken our convention center, big, beautiful building on our waterfront, one that many of you may have visited to go to Comic-Con each year. Well, it currently is going to be home to probably around 1,500 to maybe almost 2,000 unsheltered San Diegans. And this is really an elegant solution, in my opinion. The convention center is actually owned by the people of San Diego. And of course, there's very little tourism these days and no conventions going on there. And so to take that 2 million square feet of indoor facility that's owned again by the public and repurpose it, at least temporarily, for the unsheltered is pretty awesome. The second sort of best part of that is that many of the workers who work at the convention center, and these are workers who by and large are members of unions and paid living wages, who would be out of work otherwise, we believe will be serving the unsheltered San Diegans. So security, culinary, other kinds of stuff. So you see a situation where we as a community can come together and helpfully benefit multiple people: the workers who would otherwise be unemployed, the unsheltered who would otherwise be on our streets, and this public facility that would otherwise be unused. That is coupled with our hotel and motel community, who have turned over, I believe at this point, well over 1,000 hotel rooms for unsheltered and for folks who are recovering from COVID-19. We have several hundred homeless individuals who are exhibiting symptoms of COVID-19 or who have tested positive, again, who don't have the acuity that require hospitalization, but really shouldn't be in a shelter environment and surely shouldn't be on the streets. Not that anyone should ever be on the streets. In partnership with our tourism industry, our hotel, motel owners, and our county, throwing in some state money, we've reserved those rooms now. They're being utilized. It's my understanding that, again, those who are exhibiting symptoms or have a positive test are there. Women and children are in those hotel rooms. And again, that additional bed capacity at our convention center. When you look across the state, a preponderance of the beds that have been created are here in San Diego, and I'm really proud of that. Again, that hasn't necessarily been our recent history. Some of the San Diegans on this call well remember in 2017, we had an outbreak of hepatitis A in San Diego amongst our homeless population. 500 San Diegans were infected, 20 died, most of them were homeless. So this is quite a radical turnaround, and I would argue that that experience in 2017, which of course is very small by comparisons to the coronavirus, has maybe given us a situation where we took a look at ourselves and came up with some better solutions, and those solutions are playing out now in 2020, 3 years later. So a lot more needs to be done. No one is bringing out the mission accomplished banner, but we have done a number of things here that I think we can be proud of. And as you mentioned, to the extent that our LGBTQ community is overrepresented in the ranks of the homeless, the fact that we have hundreds of additional beds that we did not have just a few weeks ago is a good thing. I'll just end on this note, that I would never say that there's anything that can really positive can come out of this pandemic, but it is my sincere hope that these things, again, that were impossible not that long ago now are possible. I hope that we can take this situation and actually migrate these individuals from sheltered beds to permanent housing beds once this emergency is over. Because again, we hope to open San Diego back up. You know, we love visitors in San Diego. We want to put on Comic-Con in 2020. We want to welcome you all back to San Diego. But we can't just simply shuffle those folks out back onto the streets when we get the all clear. And so we're going to have to do a lot of work, again, in partnership with the state to increase the inventory of affordable housing that's available to these folks. So keep an eye on San Diego and hopefully take some of what we're doing here and repurpose it in your own communities to try and make sure that when we tell people to stay home, that for a good chunk of Californians, there actually is a place for them to go to, because as we know, for many, that is not the case.
Yeah, if I could just add on, I think Todd makes a really important point. We're, in this emergency, it's amazing all the things that we said we could never do, or it's going to take 5 years to do this, all of a sudden we can do overnight. Whether it's expanding healthcare capacity, because we know we have a shortage of hospital beds and ICU beds, that's not a secret. And also housing. Why? And Todd is right. As this ends, we need to have places for people to go. And I know I can only speak for San Francisco, but I know other parts of the state are similar. Citing homeless or navigation centers for homeless people, or supportive housing, or affordable housing for low-income people can be a huge fight. It can take years and years and years. And all of a sudden, we're able to do these things quickly. We need to really remember how we're doing this now. And, we had a housing emergency before COVID-19 had made the leap to human beings. And so we should treat that emergency similar to how we're treating this emergency, in terms of having that can-do, let's get it done quickly attitude, instead of allowing people to obstruct and oppose and fight these critical needs for as long as they want. We need to learn from this, and I hope perpetuate this sense of urgency.
I think, and let me just jump in on there as well. On the insurance side, as these cities are creating these places of refuge and these hospitals now that we're building in stadiums and in convention centers, we're also trying to figure out how we expedite the insurance needs and requirements to be able to make sure we have the ability to move forward and protect everyone involved as we create these spaces for healthcare and for shelter for so many folks that require specialized insurance. We're looking at figuring out how do we expedite this so that we can continue to have these spaces be used creatively, as Senator Scott Wiener said, and Todd Gloria, who I believe did just that's a great plan for the new mayor of San Diego. I think he's ready to go already on that. And also on reimbursement costs for hospitals that are now operating outside of their space in these innovative spaces, and also how do we reimburse folks for their coverage who entered these facilities. So, a lot of folks may not think that, the insurance world, it involves all these little technicalities in these different new spaces that we're trying to also expedite so we can protect everyone, give everybody the opportunity to be reimbursed, and making sure that these spaces are functioning and are well protected on both sides.
Great, thank you. Another question that has come up in the chat box, and Senator Wiener, you mentioned it a little bit during your opening remarks, is around data collection, sexual orientation and gender identity data collection. We know there are requirements in place at the state to collect this data, for any Department of Public Health programs. Is there anything that the state can do to, make sure that we we are getting that data and we can better understand how this is impacting LGBTQ Californians.
Yeah, it's data is so important, and it seems really boring, but I think for people on this call, I think people get it more than most, that if we don't have the data, if we don't know what the actual needs are of our community, if we don't know to what extent we're participating in different programs or not participating or impacted or less impacted, then we're invisible. And we see that, of course, around the census, where I just filled out my census form, and there's still not a question about sexual orientation and gender identity. We're still, because the federal government still wants us to be invisible. California is better, although I'll be honest, as then Senator Lara and Assemblyman Gloria will attest, there were a lot of data bills for LGBT people that were vetoed over the last decade because they cost money. And so we have struggled, even in California, to get comprehensive data collection. And then when we do pass these laws, sometimes getting the agencies to actually collect the data, it's its own separate thing. You assume that once the governor signs the law, everything just happens, and that's unfortunately not true. I think with the current pandemic, this is something that we're going to be taking a look at, and we are taking a look at, but everything is in such like fast motion now. It's like a drinking water from a fire hose. We're having trouble with a lot of different forms of data, and even different counties report different data about COVID-19 infections and hospitalizations and deaths. And so we are in need right now of more standardized data collection in a lot of respects, including around our community. And one thing is they released some data around gender of people with COVID-19, and they do actually, we were able to get them to include a non-binary category, but the last time I checked, maybe this has changed in the last few days, but as of a few days ago, that was still 0. I have trouble believing that there are no non-binary people who are being impacted. And again, not criticizing, because I think our state government is doing a lot of amazing things right now, and they're moving fast because it's a fast-moving pandemic. But I hope we can get some better data out of it.
Me too. Another thing that we've been hearing a lot of is how do we make sure that our state is, and our local communities too, are getting resources to where they're needed, and to some of the communities that have been left out of the federal aid package, particularly for folks who are undocumented. I know Assemblymember Gloria, this is something that you're passionate about, Commissioner Latta, and I don't know if you want to talk a little bit about maybe what some of the plans are to make sure that we do get resources and supports for those communities.
Carter, did you want to start?
I'll jump in. Yeah, I can start. We are working with Governor Newsom's staff very closely on what will hopefully soon be a press conference and initiative where he discusses the protections we're gonna lay out for our undocumented community. In my wheelhouse, we've been making sure that our undocumented folks and folks who don't have health insurance, if they need to get tested for COVID, that we don't bill them, charge them, and that we provide all the services that are needed so that folks can get the test and not be billed. We've been hearing on the ground and through my community network that some of the undocumented folks are just scared to go to the hospital because they might have the symptoms, but are hearing that some folks are being charged $700, $500 for the test. And then what does that mean for treatment if you are tested positive? And so we are trying to dispel all this, misinformation, but it's difficult, and why we depend on the network that we have here to help us spread the information. So I'm very confident the governor's going to be setting up a press conference to talk about these issues. We've been in direct communication with their staff on this particular issue affecting our undocumented community. We've also been working with My Health LA, with the San Francisco folks as well, to make sure that people know that the resources are still available to them. And obviously, on top of all this is the public charge issue from the federal government that is completely having us to relook at all the programs that we put in place throughout the years to make sure that we, conversations have come around about through the budget, do we create just an additional safety net program similar to what we used to have with Healthy Families that was only all state monies that don't impact people's ability to become citizens in the future. But again, that was already decimating a lot of our programs. We've seen in the program that I created for undocumented children, many of the families not re-enlisting their kids for the services because of the public charge. So this is a massive issue that we need to all work together, not only to figure out how we do this in the budget for this coming year. Again, who knows what the legislators can tell you. This is going to be just so different, the way we look at the budget, the way we look at policies. But this is so important for a very vulnerable group of Californians that we need to figure out how do we create and protect all these programs that we put in place, making sure we take no federal funds for that section. But who knows with the state budget and where we're going to end up now. So it's gonna be an issue that we're all gonna have to keep an eye on. And again, our undocumented folks are scared and are now very, very worried about, if I have the symptoms, would I go to a hospital? What does that mean now with public charge? What does that mean in terms of how am I going to be billed for the test and the wraparound services, which, by the way, we've asked the insurance companies around the wraparound services to not charge folks, and many of them, again, have agreed to do so. And again, looking at the antibody testing that is going to for sure move forward, that if there's undocumented folks who have the antibodies, that we also allow ourselves and allow for undocumented folks to come forward and be tested and be part of the solution, because we're all in it together.
What I would add to that, and the commissioner is all over it as he always is, I just want to note that this is being hosted by the California LGBT Caucus, but Commissioner Lara and myself are both members of the California Legislative Latino Caucus, and this has really been where our chair, Assemblymember Lorena Gonzalez from San Diego, and our vice chair, Marilena from LA, are working together to try and be extremely forceful on this matter. And specifically, the caucus is making 3 asks, and I'll forgive me for looking at this because I want to make sure I express it correctly, because I do want you all to share this in your networks, because these are asks. These have not been granted yet, and we're going to need collective action to make any of this happen. But specifically, we're asking to create and fully fund a disaster relief fund within the Employment Development Department for undocumented residents who are unable to work because of the pandemic. And this fund would provide individuals with immediate cash relief until there's an emergency proclamation has been lifted or until they're able to work. So essentially creating unemployment for undocumented Californians. Remove the prohibition on immigrant filers for the earned income tax credit, thereby expanding access to all eligible taxpayers in California. That's up to 600,000 income eligible ITIN holders, and 200,000 children would stand to benefit from this change in policy. And lastly, extending Medi-Cal benefits to all low-income adults, regardless of immigration status. I think the commissioner got it exactly right. Beyond whatever political challenges are, probably the chief concern or problem that we have is financial. And this is where I want to thank the previous legislators and our immediate past governor, Jerry Brown, for creating a rainy day fund that allows us to even entertain some of these conversations. These are not insignificant costs, but what's the alternative? As the commissioner is mentioning, folks not seeking care, not getting tested, not getting assisted during this and helping to spread the virus further elongating the pandemic and the economic consequences that come with it. This is why the Latino Caucus is prioritizing this. And while I don't believe we've had a conversation yet within the LGBT caucus, we do stand in solidarity with our allies whenever possible to make sure, the Latino caucus has supported many of our pro-LGBT equality bills. And I suspect that we would be very supportive of these things, controlling for the financial costs of it. And I would refer you all to some of the governor's comments earlier today. As was mentioned, he holds a Newsom at noon press conference, and he did make some comments about the undocumented today. But as Commissioner Lara was mentioning, there's more that must be done, and I would look to the Latino caucus for those who are seeking updates on what we're able to get accomplished, and really invite you all to participate in that as a part of collective action, acknowledging that the immigration issue is an LGBTQ issue. There are many members of our community who are immigrants or undocumented, and when we stand up for immigrants, we stand up for ourselves.
Yeah, I would just say, I think that it's really it's maddening. And of course, we have our fundamental disagreement with the federal government, where we try to go out of our way in Sacramento to support immigrants, including immigrants who don't have documents in many, many different respects. And that's part of our core values in California. But for the Republicans in Washington, D.C., even if they are, anti-immigrant, which is horrible, but they are, this is a health pandemic. And as Todd just, people spread COVID or coronavirus. It doesn't matter whether you have documents. We're all exactly the same in all respects. We're all human beings, but we're also all the same with respect to coronavirus. And why on earth would we not want to pay someone unemployment if they've been laid off and give them an incentive to leave their house and desperately search for work so that they can take care of their family? We want people to stay home, whether you have documents or don't have documents. We want everyone to stay home. And when we marginalize undocumented immigrants in a health pandemic, we're just making the pandemic even worse. We shouldn't ever do it, but in a health pandemic, you have that extra negative consequence. And it's unfortunate that the politics of immigration in Washington, D.C., even during this global pandemic, are so toxic.
I would also just add, as Scott was saying, in terms of data, we need to fight to make sure that we get appropriate data on the amount of undocumented folks that are contracting COVID, to make sure that we look at, possibly where this is happening, who are the folks. Data is key, and we want to make sure that we're able to collect data on the transmissions and infections of our undocumented community as well.
Yeah, thank you all. We are getting a ton of great questions in the question box, and we're definitely not going to be able to get to all of them, but we will do our best to try to get answers to folks for those questions that we don't get to. I'm going to ask just a few more, and I want to make sure that we have time before we end for our two legislators to be able to talk a little bit about what the next few months or weeks look like for legislation and for the state budget, what you know today, which may, as we've mentioned, be different tomorrow or next week. But just a few more questions, hopefully, before that. I think in a similar vein to what we just talked about, and making sure that that resources get to folks who are disproportionately impacted and may not have access to resources. Is there anything that you all have planned that the caucus is looking at to ensure that trans Californians have access to the economic and health resources that are a part of the relief efforts, or to any thoughts around intentional investments in trans organizations or trans-specific solutions to support our communities?
Well, So we, as a caucus, we adopted 3 budget priorities this year. One of them is funding for Assemblywoman Gloria's bill to require that all teachers be trained in cultural competency for working with LGBT students. One is the Ending the Epidemics budget ask, and one is a significant budget ask to support the trans community, particularly around housing, health, reentry, and a few other areas. And it's very important because the state historically has not invested in even the same universe that it should be investing in the trans community and providing that support and putting our money where our mouth is. And so we have prioritized that budget ask. We obviously the budget situation has shifted significantly. We don't know what the numbers are yet. I know just in my own city of San Francisco, they're now projecting up to a $1.6 billion budget shortfall over a 2-year period just in one city. And so we know that the California's budget is going to take a hard hit. And so it creates a lot of uncertainty, just in terms of keeping the, as I call it, a lights on budget for keeping the lights on for our existing programs. But we are definitely working to see what we can do. And I think we'll be working with the coalition in terms of how can we key some of these budget requests for the trans community in some way to COVID. And we know that health access, our healthcare access is a huge issue, or lack of healthcare access is a huge issue in the trans community. We know that trans people are more likely to be homeless, which is not a good thing during a health pandemic. And we know that, we have real problems in our prison system now. And I think we're all bracing for what might happen in our state prison system in terms of COVID-19 potentially spreading like wildfire. And that's the last thing we need. We need to reduce our jail and prison population to try to keep people safe. And we have trans people who are incarcerated, who are already treated very poorly, housed according to their birth gender and not given the option of being housed according to their gender identity, who are at increased risk of violence. And now you add this health situation on top of it. So we want to make sure they can leave prison and then re-enter the community in a safe and healthy way. So these issues, even though the budget situation has changed, these budget priorities have not gone away. So it's going to be a painful year and probably a painful few years, but we got to stand up for our trans community members. Todd, I know you're also very involved in these issues.
Well, I can't say any better than our chair. We're going to do our best to fight for these funds. I think we would have had obviously a much greater chance of success prior to the pandemic, but recognizing again the acute ways this can directly impact historically underinvested in communities, makes our efforts all the more necessary, and we're not giving up. So we'll do our best, acknowledging the times we find ourselves in.
Yeah, and thanks again to the caucus for your leadership on this and for working with those trans-led orgs who have been trying to fight for those investments as well. And it's always good to have allies on the inside. I think this will probably be the last question before we get to the legislative and a little bit more into the legislative and budget forecasting, as it were. But for the folks on the line who either are EDs of nonprofits or own small businesses, can you talk a little bit about some of the resources that exist to help them to keep the lights on, to keep people employed, to keep providing services for our communities through a time when they're not able to hold in-person fundraisers or maybe access some of the same business that they had. I know there are resources at the federal level, at the local level. Here in Sacramento, we have some local supports that are available, and then of course at the state level. And whoever wants to start.
So I'll talk about the small business issues that we've been hearing about. As I mentioned earlier on the call, we're getting calls from different mayors, business leaders, chambers of commerce, on the insurance end, which we have directed the insurance companies to give us data in terms of how many businesses and small businesses have what is called business interruption insurance, which businesses often buy, primarily the big and medium-sized businesses, not the small mom and pop shops, buy this product to protect themselves from any physical damage to their property. And now there is different opinions on what does physical loss mean for our businesses in terms of being able to access their insurance premium. The unfortunate thing is a lot of these, I would say the majority of these policies exclude viruses and pandemics. You started seeing these exclusions come after swine flu, H1N1, and so forth. And so we're in a tough position where the government has forced the closure of a lot of businesses, which has resulted in an inability for folks to pay their employees. As you've seen, the federal government has responded with some loans that will eventually turn into grants for folks who are keeping their employees and who meet the certain qualifications. We're making sure that folks aren't being, denied these loans, but we're also pushing the insurers to do more here in California and utilizing the power of our market share, which California is the largest insurance market in the country, fourth in the world, to force the insurers to give us more here in California for small businesses, and particularly those small businesses who don't have any type of coverage. So we have been having ongoing conversations, the governor's office, my team, and various insurance providers, as well as Chamber of Commerce, the Small Business Forum in the state, to figure out how do we come up with and what would be an appropriate action that we can take here in California. And so stay tuned, we're working on that. We're very hopeful that the governor and I will be announcing something very soon. Obviously, it's not going to be perfect. It's not going to be a one-size-fits-all, because the other thing is, if in terms of my responsibility, is to make sure that we have a thriving insurance market to pay out claims, especially as we're still trying to pay out claims from the 2018-2019 fires. So if I do anything that disrupts the solvency of that market, that puts in peril the claims for folks that are still trying to rebuild after these fires. But we also know that the insurance companies have to do more. In a time where banks are doing these forbearances and are being lenient for folks on their mortgages, the insurance industry is still the last one to come out in terms of what's going to be their skin on the game to be able to help folks during this pandemic. You're starting to see some companies do that with some rebates and returning folks' premiums on the driver's side. We're trying to figure out how we can do the same similar thing for small businesses so that they can get a break during this pandemic, so that they can keep the lights on, keep folks employed, especially for those small businesses who don't have any type of insurance coverage of this nature. So we continue to look and brainstorm ideas. So we'll get back to you all on what we work on, but it's something that's on our radar, something that we're working on, and that we have an entire team of attorneys in our department working with the governor's office on this issue. So stay tuned.
Thank you. And Senator Wiener or Assemblymember Gloria, I don't know if either of you want to add anything around resources that may be available to the federal relief package or that may become available at the state or local levels that folks should be aware of?
I think it's difficult to guide folks because what's at the federal level has been appropriated and authorized, but not necessarily always being implemented with great clarity. I think the Paycheck Protection Program, the PPP, its rollout hasn't been what we all would like it to be. I think even the administration acknowledges that, and certainly those funds are. Some of the groups you're talking about are eligible to receive them. My guidance at this point would be to, because you have to go through a private lender to access those resources, to make sure that whomever you work with, if it's not your trusted lending institution, to make sure they're certified by the Small Business Administration. The potential for graft and other sorts of bad behaviors is not minimal. And so we want folks to be careful. At the state level, we have put some more money into the infrastructure bank, $50 million, I believe it was last week. There's funding that's flowing, but it's hard to represent that any of these funding amounts match the size of the need that is out there. And so between the lack of sufficient funding, along with the program implementation challenges, I really worry for not just nonprofits who work within the LGBTQ and HIV communities, but really for every small business in California, because they're all hustling for the same sources of funds. I'd also want to make sure people recognize and know that often there can be some local resources. Here in San Diego, our city has repurposed some of our federal community development block grants into small business relief funds. Again, $6 million went like within a few minutes, but it's a resource that's out there. And we have our local San Diego Foundation has also created a relief fund, as well as our local United Way. So again, none of these funding sources are sufficient to match the need, but I do think that when looking at a process, particularly for those philanthropic funds that may be competitive in nature, the population that we're reaching out to, the folks that we often are serving that may not be served by anyone else, and as was discussed with the undocumented population previously, may not be eligible for anything else than this. These might be reasons to look more local and to still put your ask forward, because we may be able to be competitive in a way that others may not be able to be. And just know that we continue to work on this. There has been discussion at the state level for a statewide stimulus effort. I don't know quite what that will look like, and I think that conversations like this one, identifying where needs are, will be beneficial to helping to shape any kind of future stimulus. And naturally, people like Speaker Pelosi continues to push in Washington for additional relief funds, which I think are appropriate and warranted. And again, acknowledging and trying to point out and shine a light on those areas that are just not being served may go a long way to making sure that the social service organizations who are part of this call are eventually reached. And so this is, again, a call for collective action, like with the Latino Caucus before. A lot of this stuff isn't going to happen on its own. It's going to be people really saying, hey, this is necessary, whether that's amplifying the words of the speaker who in Washington who's asking for this and maybe not getting the warmest of receptions, to those of us that are hoping that there is money left over to do a statewide fund. Let's make sure that we're lifting up our voices and doing exactly what's being done on this call, which is identifying those needs and giving us the direction to work on it.
Yeah, I think, at the state level, there, unfortunately, California, like probably all states, we are constitutionally required to balance our budget. We can't engage in deficit spending. The only exception to that is if we pass a bond, and that has to go to the ballot, and that's for infrastructure. So in general, we have to balance our budget, and so the federal government has much more powerful tools. It can go into deficit spending, they can print money, they can do all sorts of things to inject resources into the economy, into people's pockets. So I have no doubt that we will put together some sort of budget package in California, but given that we're going to see a significant reduction in revenue, it's going to be much more limited compared to what the federal government can do. The good thing is, I think the CARES Act, or whatever it's called, the Economic Rescue Package, it has a lot of potential. The small business and nonprofit loans, and I think they're probably going to get augmented in the next phase. that could be incredibly powerful in just keeping these organizations afloat and giving them a big incentive to keep workers on payroll so that the loan is forgiven. It's very powerful. And I'm actually glad that the SBA is not making the loans directly and is allowing people to work with their banks with which they have existing relationships, because I think that'll allow the money to flow much more quickly than had the SBA were overwhelmed in doing it itself. And then the unemployment, I think it's hard to overstate how important the changes to unemployment are. The fact that in California now, instead of maxing out at $450 a month, you max out at a week, you max out at $1,050 a week because of the $600 augmentation. That's $4,200 a month, which is the potential unemployment people can get. That's going to help so many people make rent, or at least pay a chunk of their rent, put food on the table. It is a game changer, and it also extends the amount of time by 13 weeks that people can qualify for unemployment, and extending it also to freelancers, self-employed, independent contractors. And even though the federal government has been a little bit slow to ramp up the expansion to the freelancers and the extra 600, that's happening. And for people who have applied for unemployment already, even though they're now, when they get their first check, it'll probably just be for the maximum 450, they will, without having to apply again, get the 600 once that is set up, and it'll be retroactive and automatic. So these two pieces in tandem, especially if they're augmented in the next stimulus, I think are game changers.
Thank you. Thank you. This has been a really great conversation, and thanks again to all three of you so much for being on the line, for taking questions, and for your leadership at the state level. Before we go, as I mentioned, I'd love to hear just kind of your best guess as at right now as to what the legislative session might look like, and what the state budget might look like. What we have a lot of folks who are advocates on the phone who engage in budget advocacy and legislative advocacy, who are just curious about what they should expect from the Assembly and from the Senate.
Yeah, please tell us.
Yeah.
I don't know. I think the two houses, the Senate and the Assembly, are not always in exactly the same place, but I think the two houses there's a lot more communication happening, and I think the pro tem and the speaker have a great relationship. I think it's still too soon to say. I do believe we will restart our legislative session. That's my belief. Just in talking to colleagues and in both houses, I think there's a strong desire. And to be clear, it's not about getting back to work. We're all working extremely hard in our communities, supporting people who are in crisis, but restarting that other part of our job, making good policy for the state. And even though Governor Newsom is just doing an exceptional job, even though I had a disagreement with him about the eviction moratorium, I wanted it to go further. Putting that aside, he's been doing just exemplary work, and California is really, in terms of our government, I think is the envy of the nation right now, and it should be, and it's in significant part because of the governor. And he's issuing executive orders, and we're relying on him a lot. Anytime an issue comes up, we have to go to the governor to fix it. Well, we should be participating in fixing these issues as well. So right now we're in recess. It's been extended to May 4th, if that's the Monday. And I think if that is a possibility, it could get extended further. The Senate, we've already changed our rules to allow for remote voting by members, because depending on where we are in May, we have members in both houses, frankly, who are over the age of 65, who may have an underlying health condition. And so we want to be respectful of people's health. So we've changed our rules. I know the Assembly is still taking a look at the issue, but I believe we will go back in session. I also, I don't think that all of the thousands of bills that have been introduced are going to all be moving the way they would in a normal session. Not only, we can make up time in our 4-week July recess. I don't think we should be taking that recess, and that will allow us to make up 4 weeks, but it's still shorter. And I think, given the this crisis we're in, I think the voters and the people want us to focus on the key issues, on COVID, on healthcare access, on housing, homelessness, mental health, addiction, wildfires, those kinds of core issues that haven't gone away. So I'm optimistic we'll get some good work done this year, but it's going to be a more focused session. Maybe the Assembly has a different view, but.
I think same zip code, different block. I don't know. I think the top lines are exactly what Scott was saying. I would say that I would characterize May 4th as being optimistic, based on the modeling that we see and whatever else. I mean, I'm raring to go back whenever they want to call us back. But I think that's our current date. But much like when we were originally given April or whatever next Monday was supposed to be, and that got pushed out, I wouldn't be shocked if that happens again. We obviously have a constitutional requirement to come back and approve the state budget in June. We most surely will be going back for that, probably regardless of what happens. The Assembly hasn't taken quite the same position on virtual voting or distance voting at this point, so we would have to do that. But I think for the advocates on the phone, folks who are very used to coming to lobby the Capitol or have sponsored legislation or do bill asks, I think it's evident that we will be doing a fraction of the number of bills that we would do in a normal year. What fraction that is unclear. My experience at this point in the Assembly is that each committee chair has taken a different view on it. And so we'll kind of remains to be seen what that means numerically. But we're definitely in a position where we're looking at what bills we really need to prioritize this year, either because they're directly responsive to this pandemic, necessary for state function, or maybe address other obvious needs in the community, like the commissioner was talking about in terms of the wildfire response, or to what Senator Wiener was saying about housing and homelessness. These continue to be issues in the state that did not go away with the pandemic. And I think there's a general consensus that beyond making sure the state continues to function, which it surely will, that we'll continue to tackle the biggest issues in front of us, which are first and foremost the pandemic, and not follow far behind with our homelessness and housing crisis and the response to the wildfires. But again, I think for the folks who do this professionally, bank on the fact that there'll be far fewer bills, a very quick legislative process, a budget process that will probably be a skeleton budget in June with some augmentations in August and in the fall. And let's hope and pray that we get back to a position where we can go back to a normal legislative calendar next year. But I don't think that will be a hallmark of this year. And it makes me a little bit sad because it's my last year in the legislature, and I was really I'm not one for doing sports metaphors. I'm true to the stereotype in that regard, but I was looking to sort of swing for the fences with my last legislative year. And what I will just hope to do is do some quality legislation this year that does directly impact our queer community, our HIV community. I appreciate the chance to serve in the legislature and to be your voice there. And with my allies here, Scott Wiener and Ricardo Lara, will do our very best in concert with the organizations like Equality California that have sponsored this webinar.
I think I'll just add, and give you this new perspective that I find myself in after being, chair of appropriations, being on the budget conference committee, and informing my staff in terms of how do we really just focus and maybe words of advice for all our advocates there is, how do we zero in on one issue, on one critical thing that we need to address during this pandemic that our community needs, and work on that issue. We are downsizing our legislative package. We are downsizing our budget asks because we know that this is a reality, and we can be as hopeful as possible, but the facts are the facts that we're going to have to really ratchet down what we want to get done this year. And to the extent that we can align ourselves with the goals of the state and the goals set forth by both houses of the legislature and the governor, that everything else has to just be put on the parking lot for right now. And so those, as an advocate for my agency, an advocate for consumers that's what I've asked my staff to do, that, everything else can wait, honestly. And so let's focus on what those issues are that are critical for our community that we need to fight for now. Because the last thing we want to do, and Senator Wiener and Todd can tell you, is we don't want to get left out in these conversations. And so making sure we're part of the discussion, but that we're also focused and that we are, disciplined to ask for the right things that we need to address this current situation we find ourselves for our community.
Right. It's the classic saying, if you're not at the table, you're on the menu. And we're very glad to have the three of you at the table and advocating for our communities. Thanks again so much to you for being on today, for taking folks' questions, and for sharing, I think, a lot of really great information about where we are right now and where we're headed over the next year in our response, at least to the best of your abilities. And I know, like we said at the top, it's an ever-changing scenario. So thanks to all of you. Thanks to our sponsors, to End the Epidemic, to Equality California, and to everyone who joined us today. We know there were a lot of questions we didn't get to around how to support folks in rural communities, how to take care of our community's mental health. And we hope to have those continuing conversations over the next few weeks. We want to continue to be a resource for you through these calls and through, in any way that we can. And we are going to do our best to get answers to you to those questions that were asked. And we will be in touch with the information that was shared on this call, and also with information about other upcoming events, other opportunities to get engaged in the advocacy efforts that we talked about, and in accessing some of the resources that were discussed today as well. So thank you, stay safe, stay home, wash your hands, and we'll talk to you soon.
Thank you.
Thank you.
Thanks. Bye.